This first adjustment is for the carpals. It's done by hand. It's a scaphoid or lunate, or any of the carpals for that matter, palmar to dorsal. It's an index digital contact with thumb index stabilization. It's done by hand. It's very much like the assessment that we did. All right? So let's review the setup for the assessment. I grasp the distal radius and ulna with my thumb index web. I hold up the wrist into neutrality with my pinky. But instead of assessing it, I'm going to grab the carpals with my index finger, right? And I'm going to load it up into a palmar to dorsal direction. Right? So I pull up with my right hand, I stabilize with my left hand, and the delivery is, it's an HVLA thrust. All right? All right? You just explode, and you've already preloaded the direction. All right? There's some other adjustments you can do by hand that are for the dorsal to palmar direction. Right? So the first one I want to show you is kind of like shaking hands. Right? It's kind of like shaking hands. This is how I would shake hands, correct? Right? However, I'm going to fake them out. I'm just going to come over the top. Right? What that does, it puts my thumb where? It puts it right over the lunate. Right? So this is a dorsal to palmar thumb contact reinforced with my other thenar. Right? So there's my thumb contact. What's important to see is, turn this way for a moment, is what my other fingers are doing right there. All right, turn this way a little bit. My fingers are just splayed out around the front of the wrist. Now come back and face me. All right. So what I'll do now is I'll take my other hand and I'll place my thenar over my own thumb. That's thenar reinforced thumb. But I let my fingers wrap around. I let my fingers wrap around and intertwine. All right. Now this squeeze that I'm maintaining right here, you can feel the traction. That alone is some traction right there. But when I make that thumb reinforced contact, now I'm really tractioning. And the squeeze alone is most of the adjustment. So what I'm doing right now is practically the entire adjustment. I'm creating that dorsal to palmar movement. All right? My thumb is going up the forearm. That'll prevent me from extending the wrist. From here, what I'll do is just lean down a little bit. A little traction downward, right? And the adjustment is just a little bit of a punch like that to deliver the adjustment while you maintain the squeeze. If I wanted to affect, let's say, the scaphoid, I would do the same thing, but I would use the other hand, right? So now my thumb is over the scaphoid, right, over the lateral portion of the wrist. And again, I can let my fingers intertwine underneath, thenar on top of my own thumb. Again, squeeze that all together. Just traction down gently. I'm going to demonstrate a series of wrist adjustments on the speeder board. And the first one we're going to do are the dorsal to palmar manipulations of the carpals on the speeder board. So the contact is made underneath the wrist, and this is probably one of the most important aspects of the contact, because once the thumb is placed on top of, let's say, the lunate, you need to have that space open up underneath. And I'm going to just zoom in on that a little bit so you guys can see that a little bit better. You really need to have that space open underneath in order for this to be effective. We'll zoom that back out again. So once that contact is made, the speeder board is set so that it will easily close by taking your thumb and index finger and giving it a squeeze. When you want to load up the speeder board with weight, you're going to put much more tension in it. But when you want to just hit the speeder board with a contact, you want it to be able to release nicely. So the thumb's on top, fingers open up underneath, and resting on with the open edge of the speeder board right underneath. This delivery can be accomplished in two ways from here. We can place our thenar on top of our own thumb, and and then thrust into the speeder board in that manner. Or you can build a little momentum with the thrust as well, and that will accomplish the same thing. Don't come up too high, because you'll end up hurting your thumb if you hit it from a high height like that. So this adjustment right here is set up for the mid-carpals or the medial carpals on the inside of the wrist. I can also come across and contact if I come across a little further, I can contact the ulnar meniscotriquetral complex on that side and accomplish that adjustment as well. If I want to accomplish this on the lateral carpals, let's say the scaphoid, for example, all I would do is switch hands. All right. So now I have my thumb on the opposite side. All right. And that's squeezed. The camera can't see it now, but there's an open wedge underneath, and the thumb is right over the scaphoid. And again, my thenar on top. I can come from a little bit above, or I can just place my thenar on top and thrust in that manner. All right. We can use this same technique for the palmar to dorsal manipulations as well. So I'm going to turn the wrist over, all right? And the elbow is supported by the patient's own hand in all these adjustments. And the same principles would apply. I keep that wedge open underneath. So there's that wedge open underneath. And it's that squeeze that really gives me my pre-adjustive tension. I'm squeezing my hands together to give me that pre-adjustive tension. So this would be for a lateral carpal, all right? And I can just place my thenar right over my thumb and then thrust down into that. And if I wanted to do a more medial carpal, I would switch hands. In this case, let's say I'm over the ulnar meniscotriquetral complex on the inside of the wrist, palmar to dorsal, and again, checking to see that my speeder board is cocked, and then thrusting through my thumb. All right. The next manipulation I'm going to show you on the speeder board is done in the same position. This was to address the lack of movement between the distal radius and ulna. All right. And the way we assess this, remember, on the previous assessment video, was to place our digits in between the distal radius and ulna and squeeze. So this is the restriction that we're trying to improve in this position. What we're going to do is place the wrist right on the end of the speeder board. Patient's going to support their elbow with their own fist of the other hand. You want the forearm to be parallel to the table. And the doctor is going to grab the ulnar with one thenar and digit, and then the radius with the other. And what I'm going to do is shear the ulna down on the radius. So I'm doing this movement right there. Shearing the ulna down on the radius. And from here, I'm going to slam it into the board. All right? And I'll do that 2 to 3 times. Again, shear and slam. Shear and slam. Then I'll turn the board around, and I'll shear it in the opposite direction. All right. So I have the open wedge facing the outside of the wrist, the radial side of the wrist. Now I'm shearing the radius down and slam it into the board. Shear the radius down. You doing okay? Mm-hmm. Shear the radius and slam. And I'll do this 2 to 3 times. And then I'll recheck to see if I was effective in creating some of that improved mobility. And I can feel a little bit more give there as I try and push that in between. All right. So this next adjustment is a variation of what I just showed you. It's a different way of doing the same thing. All right. So what we'll do is we'll take the wrist and we'll hang it over the open end of the speeder board. All right. And again, you want to have that nice tension set properly. All right. And what I'll do is I'll take my thumb and I'll place it right in between the distal radius and ulna. I can't put it flat because it won't fit. So what I'll do is I'll turn it on its side, kind of roll it onto its side, as if I was trying to place my thumb in between the distal radius and ulna. Then I'll place my thenar on top of my thumb. And this is a case where you need more tension for this adjustment, because this is an adjustment where I'm actually going to load up the speeder board with my weight. So I'm going to increase the tension. The knob is on the right so that I can't necessarily easily collapse it with my thumb. All right. So I have the tension built up. I've placed my thumb in between the distal radius and ulna. I reinforce my own thumb with my thenar, and now I actually lean into this a bit. That's why I have it loaded up. I want to put some of my body weight into it and then thrust. So again, thumb in. I'll show this on with the other hand so that maybe the camera can see a little better. Place my thumb in there. This is set pretty high. The tension's set pretty high. Reinforce it with my other thumb. Traction into it in this direction, and then thrust through both hands. This next adjustment that I'm going to demonstrate is for a loss of flexibility in the transverse carpal ligament or the flexor retinaculum. And remember, the way we assessed this was to make a contact on the thenar and the hypothenar and see what kind of give there was when you pull those two structures apart. So you can support your elbow, and what we're going to do is have our tension set medium again. And that'll work right there. And thenar contact on the patient's thenar, digits wrapped underneath. Thenar contact on the hypothenar. And just like the assessment, gently try and pull those apart, and then use the speeder board to add a little bit of a thrust to that. So pull apart, thenar and hypothenar, and into the board. This is an adjustment that will correct all the long Y-axis dysfunction in the scaphoid, the joint between the scaphoid and the radius, between the scaphoid, between the trapezoid, and the scaphoid between the trapezium and the scaphoid, and between the thumb and the trapezium. All right, I think I got that right. Just let's recount how this usually becomes injured, right? So patient falls on an outstretched thumb, right? And that will jam all those joints together. Ski pole accidents can occur as well. So any adjustment that hyperextends the thumb during this correction isn't the best way to accomplish this. So the nice thing about what I'm going to demo for you now is that it accomplishes that long Y-axis traction without any hyperextension. So we're going to stand side by side with our patient. And the first thing we're going to do, we're going to take our outside hand. We're going to use our pinky and ring finger to grab the thumb. So pinky and ring finger grab the thumb. That leaves my thumb and my second and third digits free. With that, I take my thumb and I place it behind the patient's metacarpo joint, right? And I just squeeze it with my thumb between right over the metacarpal of the thumb, first metacarpal, right? And I grab it with my fingers in the front, right? Just like that. Squeeze it. So I'm squeezing. So again, index, ring finger, and pinky around the thumb. Take my thumb, place it on the proximal part of the first metacarpal, and take my other fingers and wrap them around and squeezing. I'm squeezing the thenar pad with the other two digits. Then what I'll do is I'll take my other hand and I'll put my thumb on top of my own thumb, and I'll use my other fingers, all of them, to squeeze the two fingers that are on the thenar. And again, doctors, this squeeze alone is most of the adjustment right there. Just that squeeze, you'll feel the traction. You'll feel the joint open up. From there, I'm standing right next to my patient, and I just place the back of the hand on the anterolateral part of my thigh, the outside of my thigh, right? And I use that contact to traction by bowing, and I just bow a little bit, right? Just enough to produce a little bit more traction. Not pulling down at all with my hands. All the traction comes from that little bit of bow because I placed it on my thigh. Is it okay if I demonstrate this? From here, the adjustive force, the force generator is straight down, okay, towards the floor. okay, from that position. All right? Very effective for opening up all those joints and very tolerable in terms of comfort, right? Because you're not extending it. Once you start to hyperextend that thumb, it can become very, very uncomfortable. When you set this up, right, you want the palm facing forward, of course. You're gripping the patient's thenar with your thumb and your second and third digits. And then when you step in, the choreography, this is important because it all has a purpose. So the reason to stand perfectly next to your patient is so that you can take your arm, right, and position it so that when you make your contact with your other thumb and digits to reinforce the contact you made first with your thumb and digits, so there's the squeeze, you're holding on to their arm as well with your arm, right? So then when you make contact, so you bring this to your thigh, wherever it might land, okay? You're on the lateral part of your thigh, anterolateral part of your thigh, and you're on their arm with your arm. I'm kind of moving it there to show you. Then you bow, and then you add your thrust, all right? So that's the part I wanted to talk about, getting this contact on your arm. When you practice this, think of the exact choreography for it, because it'll help you to be successful and consistent at performing it. So patient, you're side by side, like almost touching. Get permission to be here. You're close to the patient, right? I always tell the patient it's okay if I'm this close, right? Because I'm literally on him, I'm leaning on him. You have to be leaning on the patient. Then make your contact and put it all together exactly the same way every time, and you'll start to get really consistent results with that particular manipulation. This next series of adjustments are for the elbow. We're going to do 2 supine elbow adjustments and 2 prone elbow adjustments. First one I'm going to show you they all relate to the assessments we were doing. The first one relates to a person who's lost some extension in their elbow and they have tight forearm flexors, right? So you lost a little bit of extension when you loaded up the forearm flexors by stretching, by extending the wrist. So we have our toggle board in place, and we're going to have a medium setting here, not too firm. For all these adjustments, the open wedge will always face the patient's head, right? And we're always going to line it up with the patient's arm, right? So the elbow joint is right at the end of the open wedge. And for this first one, we're going to take our pinky, right, and we're going to place it in between the patient's thumb and index finger. Yep. And what that's going to do is that's going to allow me to extend the wrist and supinate the forearm. Right? So when I supinate the forearm, what happens to the arm? It wants to rotate outward, doesn't it? So what I'm going to do is I'm going to make a thumb middle finger contact on the distal part of the humerus. And this is the important part here, because if you cross the joint and you end up on the forearm, you're not accomplishing anything at the elbow, right? So the thing is to take your thumb and your middle finger and slide down till you get to the distal end of the humerus and grab onto it so that it won't rotate outward when you load the forearm up into supination with wrist extension, okay? So he'll put it all together. What this hand is doing is extending the wrist and supinating the forearm. What this hand is doing is grabbing onto the humerus and preventing the whole elbow to rotate outward. That brings my hypothenar right over the proximal forearm flexors on the medial side of the elbow. What I'll do from here is thrust down with both hands as I increase supination and wrist extension and elbow extension all at the same time. So my hypothenar is kind of like a hammer coming down on top of the forearm flexors. And there's the delivery right there. So looking at that again, and we would perform this 3 times. Get a nice grip on the distal humerus, rotate so that the forearm supinating and the wrist is extending, and you're going to come down all together, putting all these components together. Elbow extension, supination, wrist extension, the hypothenar coming right down on the forearm flexors. You okay? All right. The next maneuver is similar, except it's for the lack of supination caused by the radius knot going backwards, anterior to posterior. So for that, we're going to switch hands, right? So notice my hand contacts here. This hand's going to come to the wrist. This hand's going to come up to the elbow, all right? It's similar in that what this inside hand is now going to do is to supinate and also extend, right? But now I want this contact to go over the radius, which is on the outside of the elbow. The purpose of the thumb and the middle finger here is to accomplish the same thing, to cause some resistance as you try and supinate. So you have to be above the elbow with this contact. It's right there, just like that, all right? Make the contact. I don't have to extend the wrist with this because I'm not trying to stretch the forearm flexors, right? So I'm actually above the wrist at the distal radius and ulna. So when I put this all together, my hypothenar is going to hammer down right on top of the radius as I continue supination with the hand that's down by the wrist. So I put it all together, it looks like that. Again, this contact's above the elbow on the distal radius, on the distal humerus. It doesn't allow that. See that movement right there? It doesn't allow that movement. Prevent it from happening. In a way, I'm actually rotating the other way to prevent that from happening. My hypothenar now becomes a hammer right on top of the radius. Now, one of the important things for both the adjustments I just showed you is when I thrust with this hand, the elbow wants to do this. So this hand's preventing that, right? This hand is actively creating extension the entire time. These next two adjustments accomplish similar problems that the supine adjustments fixed, right? Especially the first one. So the first one is a patient. This next one is for a patient who's lost elbow extension due to tight, short forearm flexors. So the patient's prone, the open wedge is facing cephalward and it's cocked. The olecranon is facing up towards the ceiling. The elbow is near the open side of the wedge. Think of yourself as shaking hands with the patient, right? So how would I shake hands normally? I would shake hands like this, right? I wouldn't shake hands this way. This would be an abnormal handshake, right? So this would be a normal handshake, just like that. And shake hands in such a way that you can control wrist extension and supination, right? So before you do anything, make your handshake contact, then place your whole hand on top of the elbow, top of the olecranon. From there, you're going to extend the wrist, supinate the forearm, right? Extend the elbow, so now everything's stretched, right? And the thrust is straight down towards the table, right, on the board. So again, the olecranon's facing up. Just get your hand right on top, flatten the elbow out on the board, extend the wrist, that stretches the forearms. Keep it supinated, it continues the stretch. Now lift up, so you're extending the elbow. I'm lifting up with my right hand, you okay? And then thrust down. All right. The next adjustment is similar. It's going to improve extension at the elbow due to somebody who has very short, tight biceps, right? So start out with your contact on top of the elbow. This is very important here because what I'm going to do now is pronate the wrist, right? And if I don't make this contact first, I'm going to lose that nice position on the board. So make your contact here first. Load it up with some tension so it doesn't collapse too easily. From here, pronate, maximally pronate. You don't have to worry about extending, flexing the wrist, but maximally pronate. And then with my right hand, I will gently lift up to extend the elbow while I'm stretching the biceps out. Pronation is going to stretch the biceps. And again, it's a thrust down towards the floor. Starting from the neutral position, contact in place so the elbow doesn't move. The elbow will move if I don't make the contact first. Firmly down on the board, maximally pronate. Now start to extend and then thrust into the board.